I'm currently going through the egg freezing process, and I wanted to make a video to show how to administer some of the medications yourself, because I know that is a big barrier for some people who might be interested or looking into going through the same process. In this video, I'll show you how to administer Gonal F and Menopur, which are two of the main medications that are typically used in the antagonist approach to egg freezing. Once you've iced your stomach for about 10 minutes prior to the injection, you're going to want to clean off the stomach with an alcohol swab, and then you're going to take the Gonal F pen and make sure that it's set to 0 and has the needle attached to it. And then you're going to want to dial the dosage amount that is prescribed to you and make sure that you can see that number in the dial. For me, it's 150 IUs. Next, you're going to want to pinch the skin where you're going to inject the medication, and then you're going to want to inject at a 90-degree angle and press down fully on the top of the pen to make sure all of the medication is released. And then you're going to want to just hold that down and hold it in your stomach for about 3 seconds or so. And then once you're ready to release, you'll let go of your hand and then replace that with the gauze pad and pull out the pen. Okay, so now you're going to want to put a little bit of pressure on that gauze to make sure that there's no bleeding. But there shouldn't be any bleeding, or if there is, it should be very minimal. And then you're going to want to throw that gauze out and put the cap back on the needle of the pen, and then twist the needle off and put that directly into the medical waste bin. Then you're going to put the cap back onto the pen, and if the pen is empty, you can toss the whole pen, but if it's not, you're going to keep it for your next dosage the next day. As you can see, I'm going to ice the other side of my stomach where I'll be putting the Menopur in. Next, I'm just going to open a new alcohol wipe and set that aside for now. And then I'm going to open the 2 vials, one of the sodium chloride solution and then the other of the Menopur medication itself. Next, I will open the needle that I will use for the injection itself, which will be administered subcutaneously, which is just under the skin. Next, I'm going to be opening the syringe, which has the mixing needle attached to it. However, I am not going to be using this mixing needle because I have what's called a Q-cap that will help me mix the solution into the medication. So we're going to twist off that needle and then set that aside. Now I am taking that alcohol swab and cleaning off the top of the sodium chloride vial as well as the Menopur powder medication vial, just to make sure everything is sanitary. Then I'll pick up the syringe again and I'm going to pull the plunger out to 1 cc, and I want that 1 cc of air to be in the syringe. Once I have the 1 cc, I'm going to take that Q-cap I talked about earlier and I'm going to peel off the top of it to expose the needle that will go on top of the vials. Make sure that you're not touching that needle. So then I'm going to put the Q-cap on top of the sodium chloride, and it should make a clicking sound, and then you're going to take off that plastic top. Next, you're going to take the syringe that is at the 1 cc mark, and you're going to screw it onto the Q-cap. And then you're going to push the plunger down to release the air into the vial. Once that is done, you're going to invert the vial, and then you're going to feel that the plunger is getting pushed out almost automatically, which is what that air is for. and it's going to go right about to that 1 cc mark that you had before. Take a good look and make sure it's at the 1 cc mark, and then tap out any bubbles that you might see. Then you're going to pull the Q cap with the syringe attached, and you're going to place it back onto the powder Menopur vial. Again, it's going to click when it's on securely, and then you're going to plunge the 1 cc of the sodium chloride solution into the powder medication, and that's going to help dissolve it. Swirl it around a little bit to make sure everything is dissolved. If it's not all the way dissolved, it might cause pain when you're putting the injection in. I think I made that mistake the first time, so just wanted to warn you now. Then you're going to invert the vial, and then you're going to pull out all of the solution that's inside of that vial, which should again be around the 1 cc mark. And then you're going to want to tap out any of those bubbles again to make sure that they're not causing any pain once you're doing the injection. Take your time, make sure all the bubbles are out. This is a really important step. Then you're going to unscrew the Q cap and the vial from the syringe, and you're going to replace that with the injection needle. Then you're going to take that cap off of the needle, and you will take a look at the solution again, and you're going to want to push the plunger up to make sure 1 drop of the medication comes out of the tip. Then give it 1 more tap for good luck. Now you can remove the ice pack that was there while you were preparing the medications. And again, you're going to want to squeeze the part of the skin that you're going to be injecting into, and again, inject at that 90-degree angle. I find it always helps to take a deep breath in, and then on the exhale is when you're going to stick the needle in your stomach. And then you're going to want to slowly push down on that plunger to release the medication. Again, do this slowly because if you do it too quickly, it might burn and you might feel some pressure. I definitely made this mistake in the beginning as well. Like the Gonal F, you're going to want to hold the needle in for about 3 seconds, and then you're going to take the gauze and press it down while you pull the needle out. Once you have the needle out, you're going to take that cap and twist it back onto the needle, and then you will be able to just dispose of the whole thing, the syringe plus the needle, into the medical waste container. At this point, you're also just going to throw away those 2 vials of medication and sodium chloride, and you're going to toss out that mixing needle that I said we weren't going to be using. Finally, you can remove the gauze and ensure that there's no bleeding, and then give yourself a thumbs up because you did a great job and it wasn't as scary as it looks.